You're listening to Behind the Screens, presented by the Clear IT Partner Program from Matson and Isom Technology Consulting. If you've ever wondered how confident, forward-thinking businesses make smart technology decisions while others fall behind, you're in the right place. Every episode, we pull back the curtain on the systems, tools, and leadership decisions that keep growing companies running strong, so you can apply them in your own business. Now, let's get into it with your hosts, Tyler Smith and Chris Harp.
Today, we're joined by Dottie Anstine, co-CEO and Chief Innovation Officer at North Valley Eye Care. Dottie helps lead a large eye care center built around exceptional patient care and a distinctive care model. With nearly 2 decades in the industry, she has led across revenue cycle, IT, operations, training, and marketing, giving her a broad leadership perspective on modern healthcare. Dottie, we're glad you're here.
I'm so glad to be here. I love nothing more than talking about technology.
You lead in an industry where time is tight, stakes are real, right? What's the reason, one of the reasons that you said yes to this podcast and this episode and being on here?
Well, I feel like leadership in the healthcare space is pretty wide. Every town, every city has a healthcare leader somewhere. Mm-hmm. And so I think it's good for us to talk about how those leadership and this industry intersect. And I think it's important to dispel the myths behind leadership and the difference between leadership and management, and really talking about how that all ties into all the changes that are happening now with like technology and AI. Because with leadership, it's something that you take into every part of what you are doing. So if I'm working on customer satisfaction, I'm going to have those principles of leadership shine through that particular topic. Complexity in this particular industry is at an all-time high. And so I think that bringing that into the conversation too sounded really exciting. One
of the things that we've touched on, in this podcast is the weight that leaders carry. That people will never see, right? So when you think about your role right now, what feels heavy in a good way or a hard way?
Yeah. In my role now, I would say what feels heavy is making sure that my team has everything they need to succeed, but not everything because the budget has a max. So just walking that line to understand what are the true needs, deciphering noise from signals, and being able to be nimble enough to actually capture that in real time, and wise enough to know what to set down. So that's always a struggle. But I think what I like about leadership is the challenge. It's not the same day every day. Yeah. Sometimes I'm like, could it just be like 10 years ago? That'd be great. Yeah. But I think that particular flavor and change and makes me use all of my brain and not just be automatic or things like that. So to me, that's challenging and exciting.
And you said something that I really identify with, which is giving people everything they need to be successful in their role.
Yes.
But with constraints. And I think that's one of the core challenges of leadership, which is understanding what aligns with the mission and the goal and how you're going to get where you're going, right, but also in a way that, actually fits within the bubble, right?
Absolutely.
And when the bubble needs to expand, when it needs to contract, are the questions that are the most difficult as a leader, because that's not always clear, right?
It's so hard. I feel like a lot of people think leadership is a chess game. It's not. It's a poker game. Because with chess, you can go back and you can be like, oh, that was your mistake right there. And all of the pieces move in the same way every time. Right. But with leadership, it's a poker game. You could have a great call about a bad outcome, and you can have a terrible call, but like, ooh, I'm just super lucky and a great outcome. And so that kind of learning can lead you down the wrong path, or can help you understand more about the work. So when I realized that it's not a chess game, it's not about wrong or right. It's about the best call that you have, because most leaders don't have all the information all the time at every single step. And so you just have to make decisions blind sometimes. the goal is to learn how to be a better decision maker and build those people around you to help you with that particular challenge.
I love that metaphor. Sometimes you basically win with a pair of twos, and sometimes you lose with like a full house.
Yeah,
right?
you're like,
that's-
well,
and leadership is knowing when to actually push your pair of twos.
Yes,
and when to back
exactly.
off on your full house sometimes.
Right,
I love
right.
that metaphor, yeah.
yeah.
Yeah, so specific to healthcare, right? That leadership kind of carries a weight, like we kind of talked about. I feel like that's one of the things that's hard to explain unless kind of you're in it or you've lived it, right? And so, for example, patients come in, they see the front desk, they see the exam room, the care, the quality. They don't always see what's happening underneath. So, give me what's a behind the scenes challenge that patients never see, but you think leaders in all healthcare will recognize instantly when they see it?
Oh, absolutely. I would say it is the complexity and the compliance necessary for every single patient interaction, every single touch point, every part of the journey. There is so much compliance. I actually wrote it down so I wouldn't forget. So we have the OIG, the CMS, we have the Federal Trade Commission, we have sometimes FBI, DOJ, if you really get in trouble. And then we have the Office of Civil Rights. We have, I think those are the main alphabet soup agencies that we have to understand everything that they put out. Not to mention every single payer. So every single Blue Cross, Blue Shield, United Healthcare, they all have a list of do's and don'ts. And so we are constantly consuming information. If we were to put it all out in like one PDF or one book, it would be hundreds of thousands of pages to understand to how to do that interaction right. And then not just do that one interaction, like 10,000s of those interactions correctly. So I think that understanding the complexity behind all of it and why things turn out the way they do is something that all healthcare administrators understand. But patients might see it as not as complex from the beginning. It's very easy. I just walk through the door and they hand me the thing and then I go sit down in the exam room. So understanding that part is something I wish were more universal.
Or I guess maybe in other areas, because we've seen it in technology too, is they may see the inconvenience, right, of it. So they may see the inconvenience. Oh, can you just email me all my records? Oh, can you email this to me? It's like, no, we can't do that,
I would love to, but
please,
there's so many agencies that tell me no.
Lobby everyone on our behalf.
Yes, exactly. Rarely do we ever edit rules. Like, let's take this rule away. I don't think we need this anymore. And so I think it's something that just continually gets added, and understanding how to interpret the law and the best way to apply it to your application is very hard. It's hard for the small one doctor practice that has 3 employees, and it's very hard for a larger practice that has multiple locations and 22 doctors. So I think it's just something that is so apparent to administrators, but so not obvious to patients.
Yeah, and it all stems from those core values, the core principles that folds up to it all.
Yeah.
And trying to deliver a great patient experience.
Yes.
While complying with everything under the sun, right? That's a significant challenge.
Yeah.
I can see that being something. And as a patient coming in, I can appreciate, because, of what we do, right?
Yeah.
I can appreciate how far it's come even in the last just 20 years of
Absolutely.
Everything was paper-based, I feel like 20 years ago.
We're still faxing.
Yeah.
I think I looked at a technology that uses AI to read incoming faxes, and I think it's just so funny that we have this, very old technology that we're applying the most advanced technology to interpret and make better.
Yeah.
And that's a great example of compliance, right? Because the only reason fax, in my understanding, correct me if I'm wrong, the only reason fax is still around is because somebody a very long time ago thought it was the best way to preserve privacy.
Yes. Right? Yeah. Absolutely.
And even though now all fax is sent over the internet, it's encrypted, right? Just like any other communication between point A and point B in healthcare. And there's really no good reason for it to exist except it's baked into like HIPAA and 30-year-old compliance rules or 40-year-old compliance rules.
What's different in leadership in healthcare as opposed to maybe other industries, construction, agriculture, things like that?
I think, so it's, yeah, like you said, it's hard for me to compare because I don't have a good comparison to other industries. But from my perspective, looking outside in, I would say that leadership in healthcare is so tied to values and what you're doing. Yeah, we're selling time with a doctor, which means the product is trust. So we have to have high trust, and high trust situations. That means you have to really live your values in every single decision that you make. When you make widgets or you make cars or something like that, I'm sure there are a lot of values that go into it, but every single touch point with our customer has to have high trust and high visibility. And I think that's going to be key for healthcare leaders. So yeah, I think that our particular industry, healthcare, is so tied to values and the fact that we are caring for another individual. That whole dynamic of I have an expert trying to take care of people who are not experts, and then being paid by a third party. Right. It's complex. Human relationships and understanding our own constraints and how we can best take care of patients is really, really key. And so I think that it's that trust and values mix. I also think that for healthcare, specifically my role, the administrator doctor dynamic is probably unusual to other industries. So we have doctors who go to school for years and years and years, come out of school knowing very much well how to take care of patients, how to be a doctor. Then I have the business side, the administrative side that knows how to read a P&L, that knows management principles, management versus leadership, that knows all of the HR laws, billing, the revenue cycle. All of that is foreign to doctors when they graduate. And so having this information divide and then working together as a team to be able to move the company forward is probably unique compared to other situations where the leader is the knower. Like in tech, the leader is the person who's developing the code or knows the secret sauce to the company. So in this case, it's very much a team sport.
Yeah, providing the service, right? Producing a product, which is going to be the service.
Yeah,
right. It's a very interesting. I guess I never thought about that.
Oh, it's such a unique dynamic compared to other industries because we're each experts in wildly different fields.
Right.
But we have to come together with mutual trust and communication and be able to leverage the best outcomes.
Yeah.
Yeah, so you had mentioned trust, which I kind of want to dive into a little bit because I feel like trust is everything in healthcare. And sometimes protecting it isn't the easiest or the cheapest path, right? Most cost effective, of course. What's a decision that you've made that protected trust, even though it was inconvenient, expensive, and maybe even unpopular in the moment?
Yeah, that was when I was reading the questions. That one took me a minute to really think through. I would say I have two answers to that. The first answer, very applicable to who I'm speaking with, which is bringing IT in-house and really focusing on developing that IT side and translating that to ownership and understanding like, hey, this is really important, but you don't see it every day.
Right.
This is something that it's not important until it is. And when it is important, it's too late. Like the cat is out of the bag. So being able to explain the need and the necessity for something very technical that ownership doesn't feel every day is very difficult at times to communicate when I was in the beginning of my career and just starting that IT department, bringing in a house. And so that was really, it was not a popular decision to put all that investment and development into another support team, but it was very key to our success in being able to grow and expand because we were able to become more nimble. And we're good. We're solid, and I think that our hybrid model has been really part of our secret sauce of how we can go quickly but still have high quality. And I think that's like a unique unicorn. If you got that, you should keep that.
Yeah, absolutely.
And then the second one that's probably more overall to the company is our commitment to access to care for everybody, regardless of ability to pay. we have decided to not let the reimbursement fee schedule dictate what patients we see and what patients we don't see, which is very challenging as a business. If I put on my CEO hat, I'm just like, wow, this is hard. It's way more complex. It's more fee schedules. It's more patients. It's more needs. And so thankfully, and the reason why I love working for Ridge Eye Care, the umbrella company in North Valley Eye Care, specifically in Chico, is the commitment. It's part of our mission. It always has been. How can we get access to care for everybody? How can we expand access to care? Because it's vision. We're saving vision. And that is, you shouldn't have to have that choice of do I go see the eye doctor or do I not go see the eye doctor? And so we are trying to break down barriers to make that true. Not popular, not easy, very expensive, because there's the realities of the reimbursement fee schedule that doctors have to live every day. So in a system that makes it hard to take care of patients who need the care most, we are trying to do our best to provide that to the entire North State. And it's not easy.
And I just want to pause there for a second. That's special. That is
very
something
special.
that's remarkable. And I don't know if how many of your peers would do the same, right? That's a very, I think that we talked about principles earlier, we talked about mission, we talked about kind of leadership versus management. And I love that because that basically focuses in and says, what do we believe in? How do you make sure that the business stays whole and that people get paid and that things keep moving forward, but also never compromises on its core values and its core mission? So that's remarkable because I imagine that's not altogether common in the industry. But.
No, I have not seen it in other practices, and I think that's what drew me here. So I originally moved from Indiana to come join Ridge Eye Care in 2016. So I think I wouldn't have just done that for any practice to move across the country. And so I just was really inspired, but that's always been the mission. The ownership has always been true to that point, and it makes a very special atmosphere to work in. And having it always there and having it from top down makes it so much easier as a higher leader, but not the owner, to be able to use that to inspire others. Yeah. It's really great.
We use our mission is like our North Star.
Yes.
Right. And I think what we use in our leadership, meetings or executive team meetings is I feel like it always comes out that if a decision needs to be made or we're discussing something that maybe needs to change, it always comes back to, does this align with the mission? Right. And if it does, then you're on the right track. If it doesn't, then you scrap it and you move on to the next idea. Right.
Absolutely.
And so you, I believe, mentioned a little bit ago about growing, an organization growing, right? And that when growth comes along, you have to set the stage for what you're doing now. And if the plan is to grow, what you're doing now has to be replicated, it has to scale, it has to grow and evolve, right? And therefore, leadership needs to evolve. And so, as North Valley Eye Care has kind of grown, what leadership habits have you had to strengthen or intentionally let go of? The let go part is kind of the challenging, answer there, or the challenging question there, right, for you to answer. But I feel like as leaders, you take what's working and what you feel can scale, and you strengthen that. And then there are some things, myself included, Tyler included, where there are things that are like, you've got to let go of this. This has got to go, right? Absolutely. Take me through some of those for you.
Yeah, I think there's a lot of research or probably writing out there about this particular topic. And what I found is, if we want the snarky version, it's the Peter Drucker quote, people are promoted to their highest level of incompetency.
Peter principle,
The Peter principle, yeah. So I think that's probably the snarkier version of it. But I think the truth underlying there is that growing and expanding is the constant understanding of what got me to this point may not get me to the next point, and understanding like what the new assignment is in every promotion. So every step or every expansion, what is the new problem? What is the new challenge? Where are we going? Where's that North Star? And really understanding what got me to this role, is not going to help me succeed in the next role. So in my particular experience, it was I was the doer. Man, I did everything. I understood RCM. I was the doer. I was the expert. And I was able to really help Ridge Eye Care understand the technology part, understand data analytics, and move that forward. Stepping into the co-CEO role required me to I can't be the doer anymore. There's too much to do. That would be impossible. And there's two of us. So I think understanding that the new role, the new idea is development. And I have to be able to develop a team and watch them succeed, watch them become the experts, and watch them be able to take on more, because one person is not enough. You can't scale with one person. You have to scale with a team, because with a team, you can do more simultaneously. You get more ideas, you get more perspectives. And that is something that I didn't learn I was learning the first year and, being in this role. And then a couple of years in, now I'm seeing that come to fruition. So it does help, understand, the new expectation or the new level. And so being really honest with yourself and knowing what is it does the team need, what does the company need, and how am I either a bottleneck or how am I moving that forward is really key.
Which I think is having that, and a term that we use in turn is having that next generation leadership under you.
Yes.
You want to have the right people in place. You want to empower them, and I think that's a big step in leadership.
The insight that I think I really like is what got you where you are is not what will get you to the next step, right?
Absolutely.
And I feel like that is the quintessential challenge of growth in an organization, especially when you come from an operations background.
Yes.
And I think all three of us are in similar
Yes.
states here, where you build your early career on being the expert.
Yes.
On knowing how things work, on solving problems, on overcoming challenges, on literally being the hands and the eyes and the brain behind the direct solution.
Yeah.
And when you get to a certain level in any organization that's grown, like you said, you have to disconnect from the direct doing at some scale, and then start to motivate and inspire others to take on whatever made you successful to get to that point. And transitioning from being able to do the thing to being able to articulate how to do the thing is way more challenging than any of us expect. Right?
It's so true.
It's the old, I think Willie Mays, and I'm probably ruining this, my uncle is the expert on this, but it's, somebody says, well, how are you so good at what you do? And he said, I don't know, I just stick my hand up there and I catch it. Like he couldn't describe it. And I feel like that's the challenge that all people who come from being experts at whatever industry they're in to now trying to lead other people to be successful is exactly what you said.
Yeah.
Recognizing that at that point of transition, what got you here is not what will get you to the next stage is the critical insight. Yeah. Because if you continue on in your career thinking, well, I'll just fix it myself.
Right.
Then you're going to hit that ceiling.
Every time.
And you're not going to be able to do that. Or you're going to become such a bottleneck that the business can't continue to scale.
Yes.
Or, you end up working 110 hours a week. And, and then other problems happen.
Yes. Yeah.
But that's a key insight, I think, is how do you navigate that transition from being the expert, being the doer, to being the leader. And I couldn't agree more.
This episode of Behind the Screens is brought to you by the Clear IT Partner Program from Mattson and Isom Technology Consulting. If you've ever had that sinking feeling that your tech just isn't doing what it's supposed to, you're not alone. Maybe it's the constant tickets, maybe it's the security risks, or maybe you just don't know what you're paying for half the time. That's where Clear IT comes in. We built it for leaders who want to stop firefighting and start planning. With the Clear IT Partner Program, you get a dedicated team, real strategy, and systems that just work. No more waiting, no more guessing. Imagine your IT actually helping your team get more done, and your business feeling more in control. That's the whole point. Want to see how it would work for your business? Schedule a free consultation today at mitcs.com/hello.
Now, back to the show.
So when people hear compliance, they often think of paperwork and red tape. But in healthcare, it's obviously much bigger than that. Mm-hmm. So what's the most misunderstood part of compliance by people outside of healthcare?
I think most people think of compliance as I'm just going to watch that video and then I'm just going to piece right on out and check a box and I'm done. I think the misunderstanding of how to do compliance well or best practices is that it is something that is everybody's problem, not just the one compliance person that read the article and said, hey, we should do this. It's a team sport. And that also compliance is something that you just have to communicate over and over and over again, because your staff have to live compliance. They have to know why they do things. And I think being able to distill down all of those regulations down to this means to you, staff member or middle manager, this means we have to do X, Y, Z. And so I think being able to bring that to everybody, not just make it one person's problem, and then and make it so that it is lived every day, is the hardest part about compliance. It's not fun. Nobody wants to do it, and it is really feels like a barrier. Like, oh, my hands are getting tied now. But I think when done well, you can use it to explain the why of decisions, and that can help your staff be like, oh, okay, so it's compliance. It's not just that you don't like me clicking on any link that gets to my email. Right. It is because we have to be compliant, and because these are the outcomes. Right. And I think understanding what the compliance is there for, there's a lot of good reasons to have compliance. Yeah, there's a lot of like, oh yeah, I don't want the company to get ransomed. I don't want our patients to get their data leaked out somewhere. So I think that's the why behind compliance everybody can resonate with.
Sure, absolutely.
Yeah.
How do you keep that from being a morale drain on the team?
Oh gosh.
A loaded question.
That's hard. I think my team would probably have a different answer, but I'll just give you my what I would love to think about how I do this. So I think that compliance has to be talked about. It can't just be one and done. Compliance needs its own space. So the hard part about compliance is that it sneaks up on you, and you can't have a good compliance program if you're like, oh, what should we have done? And so understanding that it has to have its own space and giving the team time, the resource of time to be able to like just focus on compliance, I think has really helped us really improve our compliance game at North Valley and Ridgeye. So I think the understanding of this is not just something that, oh, back burner, just going to keep back burning that because it's not immediately on fire, I think is the best way to make it so that it is everybody's problem. And when it's everybody's problem, then it is a team sport. Now we can just say like, well, gosh, when my users sign in and they have to sign in like to all the things, like this really slows things down. And so now it's not just compliance, it's an operation issue. And I think that makes it the conversation more valuable, and then the outcome more valuable as well. So team sport and time.
Yeah, it's the new normal, right?
Yeah.
And this is just how it is. It's what we call in our office a non-negotiable.
Yes.
This is the non-negotiable. It is what it is.
Yeah.
And you said something that I think is important, which is understanding the why.
Oh,
right?
gosh,
So making sure that the staff understand the why. Because if it becomes a morale issue, it's usually, I feel like, because there's a disconnect between the why and the what.
Yeah.
Right? Where if people hear the word compliance and don't think as a synonym for risk management,
yes,
that's a challenge.
Yeah, and I feel like you can use technology to help lessen some of that, right?
Yes.
Lessen the burden a little bit. You can leverage some technology. Some things just you can't replace efficiency, technology, and vice versa. So take me through on North Valley Eye Care. How do you guys utilize technology to improve specifically patient care?
We are using technology in, I'm going to break this out into two answers. So administrative technology and then medical care technology. So let's start with medical care. That's very patient focused. And I think the idea there is that we have a strong passion for innovation and technology. We're integrating new technologies that are on the forefront of care to understand how we can bring solutions to our patients that just they wouldn't have otherwise. With any particular problem or care, you have to understand the problem. So we have great diagnostics, and then applying that, the solution is having great treatments. And so if you just stick your head in the sand and just say, well, that's just how we've always done it, you could be missing out on a lot of value that you can bring to the patients. And so having that technology, but also putting it through our rigorous vetting or verifying is key, because just because it's new technology doesn't mean it's effective, right? So we're always looking at ways we can make sure that we're making the right choices for our patients and bringing in the right technology. On the flip side, on our administrative side, we have brought in technology to help streamline workflows. We have an HRIS system that handles onboarding. So now onboarding now is not a very manual process. It's almost automatic, which helps set up our staff for success. All those HR compliance forms and documents are all signed right before, like, day one. And so bringing in that technology has helped that department. Bringing in technology into our IT department and having a very well orchestrated and structured networking systems to make it easy for our teams then to pivot. So when we went into pivot to having global partners and staff offshores, we were able to easily make that pivot because we already had that infrastructure set up with our Meraki networking equipment, with site-to-site VPN, and it was great. And so being able to have solutions ready is really key. So it is preparing for that next step before you even need it. Yeah, absolutely. Technology has really helped us.
Yeah. Within technology, on the AI side, right? Yeah. I know you love AI. I know you're bringing it to.
Can you define the acronym for
me? Cannot. If you don't know, the door's there.
You can go.
Yeah. So what do you see as some of the opportunities and risks to adopting some of the AI tools specifically in healthcare?
Yeah. So I would wager, if I were a betting person, that no human individual is like, I'm going to grow up and I'm going to send paperwork to insurance and that's what I want to do for my life, right? I want to click boxes and I want to just have that continual workflow be the rest of my life for 20, 15 years, right? So I think AI is going to help us as human beings, not just healthcare in general, remove ourselves from the toil and the drudgery of work and help us focus on what actually makes an impact. Now, I would say that, filling out prior authorization forms, going through that red tape is impactful. I mean, the patients do get their prescriptions then, or the insurance then knows that they're going to come see us, and then the claim gets paid. Everybody's happy about that, but that is more something that could be automated and doesn't require a human soul to go through week after week to do that, right? So I think AI is going to help us find out, okay, if we don't have to worry about that, we can automate it in some fashion with agentic AI. What can we do? We have this human now. Can they look at all of the things that aren't easily figured out, like all the edge cases? So the edge cases that we could never get to or understand, why does that insurance do that when we do this? Or even looking to see the trends, we are able to focus on what is more impactful to the business, what is more impactful to patients. Being able to, for example, just last week, we started our first endeavor into kiosk check-in. And it's such a very interesting launch because I can tell our patients really care about our staff, which I love. Mm-hmm. And I think that's great. And I think the goal for us is to show them like, hey, this actually makes that front desk person's job so much easier because they can, we can collect all that paperwork that those forms you have to fill out and somebody has to go in and type those in and get all that updated. But having this kiosk check-in system means that they can just focus on you. And so, being able to focus on that human connection, that relationship. It'd be great. We would love to see our patients walk in and then it's a calm environment. People aren't like, hold on, I need to take care of this. Can you wait on hold? And being able to focus on the people coming in would be the best patient experience. If our front desk staff didn't have all of that work to do, scanning and filling in things, we might be able then to have the better opportunity to be, hey, can I clean your glasses for you? Can I get you a drink? There's a coffee bar over here, to make that particular interaction more comfortable. if they aren't inundated with all of the things that are happening to them all at once, then they have the time to be able to focus. Oh, I remember you. I saw you last week or last month. And they might be able to remember names and be able to make that connection. And so I think that a lot of times people think that technology is going to be a replacement of humans. And I don't, never could. There's always has to be a human in the loop. But I think what it can do is take the drudgery of life or the toil of life away and help us focus on what's more important and impactful.
Yeah, we say use it to elevate, not eliminate.
Yes.
And exactly what you said is when you obviously hire the right people, you hire, you have the right people in your business. So they're obviously hired for a reason. Repurpose them to higher value things, right? Like higher value things. And I've been asked by so many people, especially being in technology industry, of like, how long is it until AI replaces us? How long is it? And I said, if anything, I think what it's going to do is it's going to do the opposite. It's going to not force people, but it's going to help people have conversations, because it should free up the interrupt-driven, patient coming in, checking in. And that's not that it's a negative interruption by any means. You guys all want to talk and work with your patients and have conversations with them, but in a higher value capacity.
Yes.
Not in a, here are the forms.
Sign here.
Yep, exactly.
Fill this out. Yeah.
No, the word I liked that you used was impact, right?
Yeah.
Freeing up people to focus on creating a higher impact for your patients.
Yeah.
And that's it. At the end of the day, all technology
that's its job.
is here to help with that, right? You have that mission. You're there to help people see or see better or see more clearly or whatever that is. But the focusing on the impact, I think, is a really important point, because that's what all good technology helps us do. In whatever industry we're in, if we can get our staff, our employees, our partners, whoever, to focus more and more and more on making a more significant impact, then that reframes the business around the goal.
Right.
And then the technology, including AI, including these tools that are moving so fast that they're scary, but they're also exciting to some extent, terrifying. It's like a roller coaster. Right? You're terrified, but you're on it. But you got in line, didn't you? But you get there, and if you can, in a leadership role, continually reinforce why. The why.
Yeah.
And if the tools are here, and it's a great lens to judge tools as well, because if the tool isn't amplifying the impact, if it isn't helping you do things, if you're actually now spending more time on the tool than the work, then it's probably the wrong tool.
Yeah.
But impact, I think, is the exact right word for this technology, because if you can frame it that way, then you can create value judgments, because all these tools have cost. All these tools have to be implemented. They all have to pass compliance, right? There's lots of layers to get them implemented. But the impact lens is exactly the right one, because is it going to help us do what we do better? If not, let's not waste time.
Yeah. I think the overall fear around AI could be attributed to the fact that things are changing. So, and fast. And so, yes, we are definitely going to use AI or technology to help streamline efficiencies, but that means that the person what they were doing now is changing. And so understanding that the change is not always bad, and understanding the change can be an opportunity is, I think, the key driver there. Yeah. And I do recognize that. I do recognize that people are like, oh man, my job might be outsourced now by AI. It might not be outsourced. It might change. It might change fundamentally. Right. But I think that's always happening, whether it's AI or something else. I think we're always moving forward as a human race. Let's
discuss partnership in healthcare.
Sure.
So, especially in healthcare, the word partner carries real weight, right? There's a difference between a vendor and a partner, in our opinion. So what makes a partner feel like part of the team, kind of without crossing those lines or without blurring those lines?
Yeah, I would say communication and expectations. So you really have to, a partner is somebody who you communicate with a lot. A vendor is somebody who's like, hey, thanks for installing that. I'll never talk to you again. The partner is somebody who you're communicating with often. And the expectations are set there to help each other out as far as being able to work together. So the best partner-vendor relationships are ones where the expectations are very clear and everybody understands how we can be successful together. And I think that a lot of times it's easy for a partner-vendor relationship to just be transactional. And the best way to leverage that is to think of how can this help both parties, because that they're, at the end of the day, we have to work together in order to get all of the outcomes that we want. And if we compete or butt heads or don't listen to each other, I think that impedes all of those good outcomes. So partnerships are really, really important in healthcare, whether it's a vendor, whether it's an insurance contract, or whether it's partnerships in the community with other physicians and doctors. I think it's really key to understand how to do those.
Yeah, we use a word internally, alignment.
Oh, yeah.
You have to ensure that you're aligned.
Yeah.
And part of alignment is expectation management.
Yes,
right? Like making sure that it's clear, trying to have some kind of a plan. Being on the same page, right? And having a really good understanding of what each partner kind of needs to get out of the partnership to make it work.
Absolutely.
And I think trust is at the core of that, right?
Yes.
And so it takes a really long time to build trust in partnerships, but it can be lost real quick, right? So tell us about a time a partner earned or lost trust. What was it that was kind of that deciding factor of maybe ending the partnership?
Yeah, I would say I've had partnerships with vendors go really well when they are when they think about the problem as a whole, when they listen to hear what the problem is before trying to prescribe a solution, and that goes both ways. So if I've blabbed on for an hour about my problem, I need to stop and listen to what the solution is and really focus and give that time and respect. So I think the best partnerships are ones where you have clear communication, you understand what's happening, and you can focus on the outcome together and how you both can reach that together. I think the harder partnerships, the ones that fail, are ones where communication is broken down. Trust, like you said, is no longer there. It's very, very clear what the either side is going for. And I think it's really important to understand at the end of the day, we're all just running a business. We're all doing what we can to help our business out. And I think if you have the mindset of it's me against them, or if I win, you lose, and if you win, I lose, that is something that can really be detrimental to overall success. So understanding that expectation in the beginning, are you a partner, or is this transactional? Are we what are our needs? Because I think no matter, even in the same space, like some people might have more need for an IT vendor rather than an IT partner. Some people might need a partner. And so I think what was very clear, specifically with Mattson Isom, we needed a partner when we started to bring IT in-house. And that was very, very clear that you guys were there to help provide that and be able to be communicative. And I think that was one of the best partnerships that we've had with Ridge Eye Care as far as managed service and organization. I think the key with some partnerships that haven't gone well is just understanding why things are a barrier. Just tell me why. Like, this is what I'm seeing. Can you explain why? And if there's not that explanation of why, then that does kind of erode the trust.
Right.
Yeah.
So we talked a little bit about AI, decisions around AI. Some people can view those as a technical decision, but they're also leadership decisions, right? They're also partnership decisions too. So right now, specifically, we kind of talked about there's a lot of noise around AI, right? And some of it's hype, but some of it's legitimate innovation.
Yeah.
So in the healthcare side of things, where do you think AI could genuinely reduce friction for patients or staff, right? Not the value side of it, but that friction point, right?
Yeah.
I think you alluded a little bit to like kind of the check-in process and things like that.
Yeah. I think it's access to care. There are only 22 doctors that have to serve a mass population for our patients. So if AI can open that access to care by doing an AI call center, we have tens of thousands of missed calls. I'm going to be honest. I feel like there's an missed opportunity there for us to take care of that patient population with a solution that doesn't have to sleep, that doesn't need overtime, the solution that is replicable, the same to over and over and over again, can handle conflict without being personally drained by that, I think is something that could be something we could look into. Could be something that is really going to have value to our patients, because when you call, it's more interactive. It's not the press 1 to talk to a front desk, press 2, it's not a robot. It's not a recorded message. It is something where the patient can interact with. Getting that information and to our patients timely is also really, really important to us. It really is important for us to get the right message to the right patient at the right time. And I think that can be overwhelming to a staff pool that's like, I'm just doing the best I can. I've got all these patients. I don't have time necessarily to go back and text all these patients or to spend that extra 10 minutes, because we have a full schedule, because access to care, there's just, the demand is there. So having AI solutions to help us with patient education and patient communication is going to be key, because that as a patient, you want to know all the things that are going to happen. I want to know, what is this procedure? Can I know more about it? I want to know, what should I expect? Where do I go? Do I go here? Do I go to the surgery center? And I think our AI solutions will be able to do that intelligently with agentic AI, versus being able to hard code the old school, if then statements, we would be coding that for forever. We'd never get to the end of that.
And people would just be mashing the 0 button.
Yeah, exactly.
Operator.
Exactly.
Yeah.
So we need something more sophisticated, more human, to help us take care of the mass amount of patients and their needs. And I think that AI is a really good solution. Again, not to replace people, but to augment people, so that if a patient really does have that nervousness, they can get right to the right person, rather than having to hunt and peck with a phone tree or get to the wrong department. And so I think that's really key for us.
Yeah, I like what you said around the value portion of it, right? Creating space where right now, based on the constraints that exist, a normal working day. Right?
Yes.
I feel like everyone expects 24/7 access to healthcare, but no one wants to pay for 24/7 access to healthcare, because it's not just 3 times more expensive, right?
Yeah.
It's probably 10x.
Yes.
So creating those opportunities where you get somebody who's calling in at maybe 9 o'clock at night.
Yes.
And being able to articulate maybe what is a simple question.
Yes.
That has a straightforward answer, that without a tool like agentic AI in play, they're just going to have to try to go find it on the website, or try to wait until 8 a.m. and then flood the inbound calls at 8:01 or 7:01 or whenever you open.
Do I need to go to urgent care? Do I not need to go to urgent care? Yeah, no.
Creating that value where it doesn't exist right now, because
Absolutely.
it's just the constraints are so high. That's a great place for AI tools to live. I feel like is. Can you ask a natural language question just with your voice?
Yes.
Do something that can answer it very straightforward in a trustworthy way that's been trained by experts?
Yes.
Perfect.
Yeah.
I like that.
And then can that AI open the door then to bring the human in the loop? So, and can it do it consistently every time with repeatable outcomes is really interesting for me as a leader, because I think every patient deserves to have that great experience. And I want to make sure we have that consistency in our product. So AI is scary, but also the opportunities there are really interesting.
Yeah. What I dislike is when leveraging AI and that automation, but passing it off as a person.
Oh no!
That I think is just an absolute no-go.
That's a total fail.
Yeah,
Trust.
We started by saying the
right
word
there.
trust.
Yeah,
it's a
exactly.
trust business. So,
I get emails all the time or whatever, like, oh hey, this is Danny from such and such technical support, and I'm like, no, it's not. You just said thank you for your email, or I hope this email finds you well. I hope this reply finds you well, and I'm like, you are not a person, Danny.
Yeah.
So I think a lot of other practices, maybe in the area or maybe in the world are kind of asking the same question now. But do we lean in on AI? Do we wait? Do we ignore it? So if a peer practice asked you, like, should we be paying attention to AI right now? What would your response to that be?
I would say start learning. We're all going back to school. It is not something you can ignore, but it's something you can't just be like, right now, this second, I'm going to implement it. You have to be very cautious with all of the regulations we talked about in the beginning. Mm-hmm. You want to make sure that you aren't putting the cart before the horse. So at this point, it's in the game, it is really understanding what's out there. Talking to a lot of people, talking to your vendor, talking to your peers to understand what is signal, what is noise, what is hype, what is not hype, and talking to a lot of vendors that are in that space so you can understand how each vendor is synthesizing and talking about it. One of my goals in my industry is to be a leader in technology and AI and education, and making sure people understand that it's important for us to keep looking, just like our surgeons are keep looking for that new technology or that new device or thing that can help them solve the disease state. As administrators, we need to keep looking for those things that can be out there to help us. So absolutely, we need to be really educated and go back to school and start learning how to incorporate this and how to verify it. Just like when the internet came out. You have to use it, but you have to use it wisely.
Yeah, to verify, right?
Yeah, exactly.
AI is, it's as much about planning it as it is using it, right?
Yeah.
So good leaders don't react to problems, they anticipate them.
Yes.
Right? And so what tells you that it's time to invest in technology or processes before it actually becomes a problem?
Oh, I like data-driven decisions. So that's data in all kinds of forms. So that's going to be analytical data. We've implemented dashboards through Power BI. We've securely moved our data to an online warehouse with Snowflake, and we are able to see more insights than we ever saw before. Speaking to your whole idea of changing from paper to digital, this is it. We're living it, and then being able to use AI to interact with that data. But then also the subjective, qualitative data. I feel talking to your team, understanding, really listening as a leader. What is the problem? And then first principles as a leader. Just 5 whys. Why? To really get down to the root of the problem and really understand: is this a big ubiquitous problem? Is this a systems problem? Is this a people problem? Is this a technical problem? And I think that's going to be really key in understanding how to leverage the technology.
Yeah, that's a really important point from my perspective too, is understanding how, getting down to the root causes and the first principles is really important, because there's a temptation, especially as this technology is moving so quickly, to just literally throw tech at it.
Yes.
Right? Just literally say, well, we have a problem. I'll bet AI will work. Let's do that.
Yeah.
And then turns out, like you said, maybe it's a people problem.
Yes.
Maybe it's a training issue.
Yes.
You literally just need 2 or 3 people in key roles to understand edge cases more completely. And maybe AI can help with that.
Yeah.
But I feel like every lesson we've learned with technology in the last 50 years at least has been, if you understand the problem more completely, you will be more successful in the implementation of technology to automate or solve the pieces that can be solved by technology.
Right.
And that's super important, because the temptation is strong, especially now because it's moving so fast and the promises are so strong. There will never be a substitute, I feel like, in small business, mid-sized business, enterprise for that matter, for understanding the problem thoroughly, and then being thoughtful about solutions that may involve technology.
Yes.
But technology is not step 1, right?
Absolutely. It's just a tool in a toolbox.
Yes. And an ever larger toolbox. But still a toolbox. Yeah.
So as a leader in healthcare, how do you decide on what truly deserves attention and what can wait? How do you prioritize that?
We patients first. So if it affects our patient outcomes, that's number 1. And then our framework is patients first, administrative burden or costs and savings there and efficiencies. And then the last one is revenue. And, is this impeding revenue? Is it helping revenue and things like that? So always start with patients and then work with my staff, and then the business will follow.
So I'm going to drop a heavy question on you here.
Okay.
You've been in this
They haven't
industry
been heavy so far.
So you've been in the industry for a while now. You've seen kind of the cycles like change and growth. If you could give yourself one piece of advice 10 years ago, what would that be?
Other than invest in certain companies, I think it would be to always stay curious. Don't lose that, and don't be afraid of people, because I have learned going through my career that it's really important to network and talk and understand anyone, vendors, your fellow employees, upwards management, lower management. I think it's really key to just keep those conversations going, because you learn so much more. I think in the beginning, I just wanted to keep my head down, just be a good employee. I'm just going to get through the day. And I think older, more mature Dottie is very, very much realizing, people are the key to unlocking all kinds of innovation, creativity, and passion. And I think those are the things that really get us up every day. It's not like, I'm going to go do some fancy clicks on my computer. I'm going to do this cool thing on my phone. It's the connection. And that is really, really key and important, which can be lost in more of a technical realm.
Yeah.
So just stay curious.
The more AI comes around, I've started thinking of, okay, you know what? We need authentic intelligence from time to time. And that comes from other people, right?
It does.
And being inspired by having conversations with other people.
Yeah.
Being honest with sharing your challenges with others that you work with, and looking for different perspectives is what makes humans great, right?
Yes.
Because the tools, the AI, the command prompts, often will just kind of be an echo chamber, and it'll say, you're right. That is a really hard problem. And you're right to think this, and you're right to think that, and you're right to think that. And I totally agree with you. Having someone to talk to and being unafraid to network is something that's really important, because you will run into those people who say, I really respectfully disagree.
Yes.
And that's how you grow. Thanks for listening to Behind the Screens. If you're ready to take the guesswork out of technology and lead with greater clarity, we'd love to help you build a plan that works. Visit mitcs.com/hello to take the next step. And we'll see you next time.